Good morning, everyone. I'm Simon Hain, the Director of Therapy with Aptiva Health, and this morning we are really excited to introduce you to Dr. Lisa Manderino. She is a neuropsychologist and the head of our Concussion and Sports Institute at Aptiva Health, and so we are really excited to introduce you guys to her. Lisa, are you able to be on the call this morning?
I am. Thanks for having me.
Awesome, absolutely. If it's all right, I'd like to be informal. Can I call you Lisa throughout today's conversation?
Please do.
Good, thank you. Lisa, we'd love to hear a little bit of background on, how you got your education, your upbringing, and, what brought you over to Aptiva Health and some of the opportunities that you saw there. So give us a little background if you don't mind.
Yeah, gladly. I don't know how far you want me to go back. I'll go back to when I was a teenager. um, I grew up in the Pittsburgh area. As an athlete, I played basketball essentially year round from the ages of like 5 until I graduated high school. And Pittsburgh was a really kind of hotbed for concussion research, and it really seeped into the culture of our athletics in that area. And so I early got interested in sports concussion as a potential career because it married my interests in neuroscience and athletics in a way that I think few other career paths could. So I after high school went to Wake Forest University to complete my bachelor's degree in psychology with biology and neuroscience double minors. Then I completed my PhD in clinical psychology at Kent State University in Ohio. I completed my residency training at the VA in Ann Arbor, Michigan, where I did rotations through their outpatient neuropsychology clinic, as well as the mild traumatic brain injury clinic, serving veterans who had a history of brain injury. And then I completed a 2-year fellowship at the University of Pittsburgh Medical Center, got to come back to the City of Champions, that kind of initially sparked my interest in sports concussion, where I completed a 2-year fellowship under the direction of Mickey Collins, who's a leading researcher in this area. And ultimately, from my fellowship in Pittsburgh, was recruited to Aptiva Health. And while I didn't necessarily envision myself moving to Kentucky, to start my career and with a young family, I felt really passionately and was really impressed by a lot of what Aptiva was doing and building to try and bring to the community to advance healthcare and especially sports medicine and concussion care in this area. And so it just felt too perfect to pass up. So here we are.
Oh, that's exciting. What a comprehensive background. You've been all over the place. Can you give me a little bit more insight into what all you did at University of Pittsburgh Medical Center? Because a lot of people hear concussion and impact testing, and usually it's seen from like an NFL perspective or from a high level perspective. Could you just give us a little bit insight into like what that training was designed to do, and how a little bit of more of a background on like the focus of your expertise in concussion care?
Absolutely. Yeah. Concussion is an inherently multidisciplinary injury. And by that, I mean, there are different brain systems and different aspects of human behavior that can be affected by concussion. It's not just that everyone who has a concussion has this particular problem. There are different symptom constellations, we call them, or kind of different symptom presentations that someone might experience after concussion. And so at Pittsburgh, our sports concussion program was embedded within the sports medicine clinic in the Department of Orthopedics. And we did cater to a lot of athletic injuries, but we also saw civilian injuries, military, car accident, bumped heads with a Great Dane. We treated concussion of all kinds there. And really the focus of the training was to be able to conceptualize this injury in any individual patient and put together a comprehensive treatment plan that could unify the the multiple disciplines that might treat a concussion. So a concussion could be treated by a neurologist who might provide medications. A concussion could be treated by a vestibular therapist who would address vestibular sensitivities after the concussion. It might be treated by sports medicine with or physiatry for different injections or manipulations. There are a lot of different disciplines that may be able to attack one piece of the presentation. And really, I think the thing that my training emphasized was we need someone to kind of integrate all of these multiple disciplinary care and help provide a comprehensive treatment package. And so that's what I would really describe as kind of my expertise as a neuropsychologist and what that training focused in, regardless of who you are, what type of injury, or how you experienced that concussion, or what type of lifestyle you're trying to get back to, whether that's playing football at the professional level or at the mighty might level, or trying to get back to your job as an office worker. Being able to conceptualize what is this injury, what problems has it caused in the brain, and how do we provide a unified treatment program that's structured and tailored to that individual's specific situation.
Awesome. And we've often coined you as the quarterback of our concussion care at Aptiva Health. But before we dive into specifically what you do with Aptiva, can you give us a little bit of an idea of some of the myths that are out there with concussion care? So, we've heard everything from, you get hit in the head, whether or not there was loss of consciousness, you need to sit in a dark room, don't take medicine, wake up every 2 hours. Like, can you kind of give us a little snapshot of some of those myths and what the research actually shows?
Yeah, absolutely. You're hitting a lot of them. I feel very passionately about correcting. There's a lot of misinformation out there about concussion, but it also isn't even fair to just term it all misinformation. Research has accelerated so quickly in this space, even in the last 5 years, that there is a lot of information still out there that is now a myth, but it was what we thought was right initially, and now it's just outdated because we've learned so much about this injury in the last 5 to 10 years. So some of my favorites are a lot of people think that you have to lose consciousness to have sustained a concussion. And actually the current prevalence is that actually only about 10% of people lose consciousness after a concussion. Some of the ones that you hit on, like you're not allowed to go to sleep after you've sustained a concussion, which isn't necessarily true. I think that is advice that was previously given to monitor and make sure that it's not a more severe brain injury on our hands. But certainly after someone has gone to the emergency department and been cleared of any more severe brain injury, like a brain bleed, there's no reason that that person shouldn't go to sleep that night after they've returned home from the emergency department. And really, I would say the biggest one that I spend the most time discussing with my patients in clinic is that research has really shown us that those rest-based protocols, or I would kind of term them as avoidance-based protocols, are outdated at this point. So individuals, especially after that acute 24 to 48 hours post-injury, there is no reason that people can't be on their phone or on their computer or go out, to have coffee with a friend. Strict rest-based protocols, or strict brain rest as they're often called, we're actually learning can exacerbate someone's symptoms and cause future issues. It can lead to mental health difficulties and depression because the person becomes detached from their support network and out of their usual activities that provide outlets for stress. But that said, we also don't want to throw injured individuals into the deep end and tell them, no, you're fine, go ahead to the Beyonce concert tonight. And it really depends on, the exact, like I was saying earlier, the exact brain systems that have been affected and the way that individual is responding to different environments and activities. We do have to put together an individualized treatment plan to kind of structure the way these people are going to return to their normal activities. But it is outdated to say that they can't go back to those activities until they're fully recovered.
Lisa, I'm so impressed by the fact that you're one of 35 fellows with your specific, 35-ish fellows with your specific expertise in this area. And you do such a good job of taking a really complex brain system and breaking it down into terms that we can all converse about and understand. One of the questions I'd like to ask to go into a little bit of a scientific rabbit hole here is, what are some of the things that we're seeing in the media with like second impact or risk of injury after a concussion? What are some things to look for when somebody does have a high level concussion that needs to be treated? Can you give a little insight into that?
Absolutely. I think in general the public has gotten one of two messages from media and the scientific research by the time it's filtered down through the game of telephone and presented in newspaper or magazine articles or on the news. People may have one of two understandings about concussion. Either number one, it's nothing to be worried about. You got your bell rung, but back in the day, we used to play through that all the time and it never caused any problems. Or number two, at the other end of the spectrum, concussion is inherently permanent, will cause long-lasting brain dysfunction, and always leads to adverse neurological outcomes. And the truth of the matter lies somewhere between those two extremes, but research is developing rapidly to help us answer some of these questions. The way I describe it is that concussion is an energy problem to the brain. Concussion is also known as mild traumatic brain injury, but whether mild traumatic brain injury or concussion is used, what we mean is that there's no structural injury to the brain. There's no bleeding, there's no swelling, there's no cell death. But what happens is our brain cells, which are these long, thin, noodly shapes, can twist and stretch ever so slightly. That allows certain chemicals to leak out of our brain cells, certain chemicals leak in, and it causes an energy problem with the brain. It just can't function and fire and do its job as efficiently as it normally would. Now, because there's no structural injury, we know the equipment is all still put together the same way it ever would be. This is a treatable injury. And when we can identify which brain systems have been most affected by this energy crisis, we can provide tailored strategies to help upregulate those energetic systems and get those systems functioning as efficiently as they did before. But during this acute period of metabolic crisis, the brain is very vulnerable. So a second impact while these brain systems are already depleted of their energy can cause more severe structural injury. In very rare cases, we do see diffuse swelling of the brain, which can cause life-threatening dysfunction. We can see the brain systems being more vulnerable to experiencing a permanent or structural injury when there's a second impact during that acute metabolic crisis. And so for that reason, the number one recommendation, especially for athletes, who are individuals who are at higher risk of having another head injury, most of us aren't at very great risk just living our daily lives, but athletes need to be removed from play after having sustained a concussion because we need to be so cautious about them sustaining a second impact during that period of time. But with appropriate identification of that injury, removal from play and from risk of additional injury, and the right rehabilitation activities, once this injury resolves and we get those brain systems upregulated again, that individual won't be at any greater risk than they ever were. So it's really, like I was saying, somewhere in the middle. Concussion is a big deal and we do have to treat it appropriately, but it's also not the boogeyman. And when we can identify it and apply the right treatment strategies, we know that we can return athletes and even, workers in kind of labor positions that might have high risk for injury. We know we can return these individuals to their activities safely if we see them and evaluate them the right way.
I love that you called it the boogeyman. That's funny. Two things that you said there that I wanted to dig a little deeper on. One was removal from play, and like, what are some red flags? So if I'm an athletic trainer, a coach, or a parent on the sideline, and a player has a head impact, and we think they might have a concussion, what are some red flags that we look for that say we need to pull them out of the game for the rest of the night versus let's evaluate them for a minute and talk about getting them back on the field?
So red flags, I would describe as need to be pulled from play immediately and probably need to be evaluated in the emergency department, or at least by someone with some medical training. And those would be any degree of loss of consciousness, complete loss of consciousness where the person for even a brief period of time is immobilized, not moving, and not responding to stimuli in the environment. Confusion, which I would describe as, asking repetitive questions. What happened? What happened? Being confused about what time it is in the game. Are they on offense or defense? Or, what activities are they supposed to be doing? Disorientation is also a red flag. And I think disorientation is used colloquially quite frequently to mean something else. But in the medical sense of disorientation, what I mean is, who am I? Where am I? I don't know how I got here. I don't know my birthday. I can't come up with information that should be very well rehearsed. And persistent vomiting. So if someone is vomiting repeatedly and not able to calm that down, those would all be what I call red flags that person should go be evaluated in the emergency department to have imaging done to ensure that there's not a more severe structural brain injury going on. Now, that said, there are other symptoms that would indicate a concussion that are less severe and less striking than what we call acute markers. Those red flag symptoms I just discussed are what we call acute markers. And by that, I mean, anyone can identify when that's happening. We don't need that injured individual to tell us what they're experiencing. Outside observers can see if they've lost consciousness, if they appear to be disoriented or confused. But there are also acute symptoms which others might not be able to observe, but that injured individual might notice. I think headache is the most frequently reported acute symptom, but also dizziness, blurred or double vision, a feeling of fogginess, which I describe as feeling slowed down, detached, or like you're a step behind what's going on around you, some nausea, or even an episode of vomiting, or any emotional changes. Now, after an injury, regardless of what caused it, there's usually an adrenaline response, possibly an anxiety response. So I don't think really being able to accurately assess emotional changes is our most reliable indication. But if those come along with some of these other symptoms that I'm discussing, that's absolutely an indication that person needs to be removed from whatever the activity was and further evaluated.
Well, that's super helpful. Earlier, you mentioned something about the impact testing. I know we talked a little bit about. Can you give us just kind of an overview of what the impact testing was designed to do? I mean, you got to train under Mickey Collins, who helped design the impact testing system. So you had, front row seats to the action to see what's going on. So can you just give us an overview of what that is, the importance of it, and what you guys are doing to help make that more prevalent today or make it accessible for the public?
Yeah, absolutely. So the impact test is at its core just a computerized neuropsychological test. Neuropsychological testing has been around for decades, coming up on 100 years at least now. But traditionally, it's administered in a paper pencil format. So I might be asking you to remember different things, or do tasks of attention, concentration, kind of paper pencil one-on-one testing. The impact test was developed to help streamline that process and make that neuropsychological testing more accessible to a larger population. There are only so many neuropsychologists, and so if we had to sit down one-on-one and paper and pencil test every athlete, it would create a real bottleneck in the accessibility of good quality care. Now, what neuropsychological testing is testing of cognition or cognitive functioning. Basically different thinking skills. So testing someone's memory, attention, different types of memory, like verbal versus visual memory, concentration, reaction time. We can test and quantify those different brain abilities. And by doing that, we can capture when one of those abilities or multiple aren't working to the level that we would expect. And especially with impact testing, It's been administered at this point to probably hundreds of thousands of people across the age range. So we do have what we call normative data, or basically a bank against which we can compare someone's scores. So if you came in and you took the impact test, even though I have never assessed you before, I can compare you to other people your same age and education level to get an idea of where you stack up compared to where I would expect you to stack up. And so if you have multiple test scores that are well below what I would expect, and you had a recent head injury, that gives me one piece of information that might lead me towards thinking there's been a change in your thinking skills and cognition, which is one piece of this diagnostic formula to figure out whether or not someone's had a concussion. Now, more importantly than just diagnosing the concussion, impact testing can give us some information about when someone has recovered from a concussion. Like I said, there are these different brain systems that can be affected. And so someone might look great on their vestibular and oculomotor testing, but if I only look at that, then I might think they're fully recovered. But meanwhile, they're having problems at work. They're getting headaches. They are certainly not fully recovered. So I have to assess all of these different brain systems. So if we have what we call a baseline test on somebody, we have a really good understanding of how their different thinking skills worked before they ever had a concussion. So we can not only see if there's a decline in those thinking skills after a suspected concussion, but we can also see when they've improved back to what we would call that person's baseline. And this is supremely important for any individuals who are at a high risk of head injury, because we can suspect that there's a likelihood they'll experience a potential head injury sometime. So it makes it worthwhile to administer baseline testing. And so the people I mean by that are athletes, contact sport athletes especially, or individuals in, high risk jobs, who, do labor, construction sites, things like that. And it's also really important for people who may have any baseline, neurodivergent qualities. So someone with ADHD, if I have never seen them before, I don't have a baseline, and they keep coming back to me and their attention scores are low compared to our normative data, I might be looking at that saying, I just don't think their concussion is all the way gone. But when I have a baseline and I know that that person has a weakness in the area of attention compared to some other brain systems that might be their strengths at baseline, then I can feel much more confident about my ability to clear that individual when the time comes.
That makes so much sense to me. Like sometimes when patients walk in the door, they for physical therapy, they have a limp or they have an abnormal gait, and the question I often ask myself is, well, I wonder how they walked before this injury. And having that information is super helpful. So I can understand from a concussive standpoint, if you know how that patient functioned before the injury, then you have something to reference when going back to. If somebody wanted to get impact testing, how do they do that? What do they do?
Yeah, so if someone believes that they fit one of those high risk groups, or honestly, if we had the availability, I don't think it's a bad idea for everyone to have a baseline test, because you just never know, right? Concussions happen to everyone every day. There's no one person. But if someone's interested in baseline testing, we do have a baseline testing program at Aptiva Health. So our athletes in the area, we offer kind of larger scale impact baseline testing. So we could bring a whole team of football players in either to our office, or we can deploy it mobily and take our testing services to their site. We could use a school's Chromebooks to be able to set up in a computer lab or in the cafeteria and complete baseline testing en masse. But we also offer baseline testing in our clinic locations. All of our Aptiva Health clinic locations offer baseline testing. So if you have a child who plays a contact sport on a team that isn't participating or opting into baseline testing as a whole, but you want to make sure that your athlete has baseline, you can bring them in to one of our clinics. Some of our clinics have walk-in hours where you don't need to call ahead and schedule an appointment, but you can also always call and schedule an appointment to bring your athlete in and have baseline testing done.
Awesome. I'm getting my kiddos in today.
Yeah.
Lisa, let's go back a little bit and let's talk a little bit about your role with Aptiva Health. So when I was a part of the team 4 years ago now, we started talking about this vision for what the Sport and Concussion Institute could look like, and it was just this big pipe dream. And here we are 4 years later. You've got a year and a half under your belt with the team, and we've got as you said earlier, a multidisciplinary approach to concussion. So what does it look like for someone coming into Aptiva Health? If they suspect they have a concussion, they call in, they get an appointment with you. What can they expect in that first few visits?
Great question. Yeah. So like you said earlier, I'm the quarterback of the team, or as a basketball player, I prefer point guard. But so that individual would come in to our clinic. Whether or not they already have an impact baseline, they will complete computerized neuropsychological testing or that impact test. Now, not everyone is appropriate for impact testing. You know, if you're not computer literate, for example, the impact test isn't going to be our best way to capture how your brain is working. So there's, again, like I've been saying, there is no one size fits all approach, and we really tailor this evaluation to the individual. But most people will take this computerized test, impact testing. Then I'll come into the room and we'll have what we call a clinical interview. I'll ask about the mechanism of injury. I assess for those acute markers or acute symptoms. We always try to request medical records. So if you did go to an emergency department for evaluation, I've already reviewed that before I come into the room to talk with you. Or if you saw your primary care or any other medical provider, I try to come in armed with as much information as I can to get a good sense of what that acute presentation looked like. And then really, we try to spend most of our time talking about how that person is feeling now, because concussion is an injury that can evolve really rapidly. If someone was injured 5 days ago and now I'm talking to them, they might have been feeling quite differently in the last 2 days than they were in those first 2 days. So I take an inventory of symptoms. We also do some questionnaires to help me try and profile those different symptom constellations I was talking about. And I do a physical exam that's called the VOMS, vestibular and oculomotor screening. And so I'm assessing those vestibular and oculomotor systems. And all of that comes into the formulation or the conceptualization of that person's concussion. I work in what's called a concussion profile model. Essentially, we can identify different profiles of this injury or different brain systems that have been affected. And by assessing all of those different brain systems and hearing the person's story and how they're feeling, I can identify what profile is causing them the most difficulties. And when we identify what profile is driving the bus, so to speak, we can target that to get us the biggest bang for our buck and help that person feel better. Now, there are some multidisciplinary programs that can take a kitchen sink approach, and that's certainly an option. You can provide all the treatments and that person would feel better. But in terms of efficiency for someone's time, money, effort in doing these therapies, what we find is that our outcomes are much better and we can help people recover a lot faster when we can target the actual profile that is driving the bus, so to speak. Now we're mixing metaphors. I'm a point guard, but I'm on the bus. But anyway,
we're on the bus to the game to be the point guard for the team.
Yeah. Right. Yeah, exactly. But once I, as the point guard, have a good understanding of what we have on our hands and the profile, I can use that to write out a coherent treatment plan that then will pass the ball to our other allied health disciplines. So someone may be referred to vestibular therapy or for oculomotor rehabilitation. They may be referred to psychiatry or psychology to address anxiety and mood issues associated with their concussion. We may refer to neurology or some of our physician partners in the concussion program for medication management. We also see a lot of comorbid or co-occurring cervical injuries with concussion, because human beings are terribly designed and we have these long skinny necks with big bowling ball heads on top of them. So if you've had a head impact that's significant enough to cause a concussion, it can also often cause a cervical injury. And teasing apart how much of this is cervical versus how much of this is neurological is part of my role, and I can help get that person in the right lane to address any musculoskeletal issues that have co-occurred with the concussion. So I pass the ball to whatever other players need it and whoever can drive the lane. And then the patient comes back to me in a few weeks, depending on exactly what's going on, and I reevaluate. And we lather, rinse, repeat. We do those same assessments. We understand how the person is responding to the treatment plan we put into place, and we make adjustments if necessary. And that goes all the way until the person has reached full recovery. And once all of my other teammates have passed the ball back to me, they've essentially signed off and said, vestibular therapy says they look great. Mental wellness says they look great. Then I kind of repeat all of those assessments to really confirm that this person has fully recovered. Every brain system that I'm assessing looks back to where I would have expected it to be prior to the injury.
Lisa, what's the message you want to send to athletes who have a concussion that are afraid to come see you because they don't want to be taken out of their sport? They're afraid they won't be able to play again next Friday. What's the message you want to send to them?
Yeah, that's a great question. I will say, like I alluded to earlier, this is not a one-size-fits-all approach. Not everyone needs vestibular therapy. Not everyone needs to go see, mental wellness. And there are a lot of individual factors that may affect whether or not someone recovers quickly or has a prolonged recovery from their injury. I will say that a lot of our active, healthy athletes recover exceedingly quickly, especially when they get to me quickly. We have some recent research to suggest that people who present for specialty concussion care in a multidisciplinary program like Aptiva Health offers recover up to 10 times faster from their injury than individuals who don't receive that specialty care within the first 7 days. So if people, drag their feet 2 weeks, we can absolutely still get that concussion better. But, we kind of describe it as being a little bit baked in at that point, or we have more to undo versus when we catch them early and can really get them doing the right things and managing the injury the right way from the jump. So number one, not everyone needs all of those treatments. And especially if I see them quickly, there's a very good prognosis that we'll be able to get them fully recovered quickly. Additionally, because we're a sports medicine program, we're very attuned to the needs and the demands of an athlete. Everyone in our program also played sports for at least some period of their life. And we understand those pressures that, being held out of sports can create for athletes and the demands on that lifestyle. So we move quickly to accommodate someone's needs. We hold spots on our schedule. I have a spot held on my schedule every single day just for athletes who may have been injured at practice last night. You can call in and get a same-day appointment with me to be able to get this ball rolling. And all of our providers are flexible and will flex their schedules to get these acute injuries in as quickly as we can. Because, again, we have evidence to show that getting someone in treatment early benefits their outcomes. So we want to make sure that we can meet that need. But there are also a lot of individual factors. Someone's medical history might impact how long their concussion lasts. Certain profiles are more likely to last longer than others. People with an oculomotor abnormality secondary to a concussion take longer to recover on average than someone who doesn't have that profile. People who have histories of migraines or psychological diagnoses like depression or anxiety, on average, take longer to recover. So there are just a lot of different individual factors that may bear on how long it takes someone to recover. And what I always tell my athletes is I promise you, I will not hold you out a second longer than I think you need to be held out for your brain health. But I also would not be doing my job if I returned you a second sooner than I thought you needed to be fully recovered when we sent you back to sports.
So Lisa, let's dig in a little bit more about what Aptiva Health offers specifically. So an athlete comes in to see you. What do you guys offer that other places might not, that prepares that athlete for return to sport?
Yeah, so like I mentioned, I function as the point guard of the team, and I'll pass that ball to other team members who might need it. Once they've all passed the ball back to me, I do all of my reevaluations. We do cognitive testing, a vestibular and an oculomotor screening, and I make sure everything looks good to me as we're there in my exam room in the office. Now, that said, because concussion is an energy problem to the brain, what we find in that normal course of recovery is that someone might look completely normal and feel completely asymptomatic when they're at rest or not really using up too much of their cerebral metabolism, but they can elicit symptoms when they start to use more energy and get more active, whether that be cognitive exertion, like really thinking hard on a test at school, which we can tap into a little bit by doing the impact test, or by participating in a lot of physical exertion, which is the obvious next step for a lot of our athletes. And that's the piece that I, as a provider, just don't have the ability to assess there in my office. And given the degree of risk that we're talking about returning an athlete back to contact sport prematurely, it is taking on a lot of risk, and it's a big guessing game to just say, well, they told me they've been going to their sports practice and they're not getting a headache there, so I feel okay about that and clearing that athlete. We've worked to really standardize this process and handle this from start to finish. We're a one-stop shop from diagnosis to full clearance for return to sport. So we're not just passing the buck to the school athletic trainer and saying, now you go ahead and do whatever your return to sport process looks like. They're okay on our end. What we do is we get them what we call an exit test. That's a dynamic physical exertion trial that our athletes will complete in-house with one of our concussion program physical therapists that puts them through some cardio, some dynamic physical activity, and some sport-specific activities. So our soccer players may be doing some light heading. Our football players may be getting bumped around a little bit and doing some light contact drills. And that's really to verify and not just have to take anyone's word for it, that they look good to us when they started participating in that dynamic physical exertion. We also take objective measures of their sympathetic nervous system and autonomic nervous system functioning, which is the system that can be kind of thrown out of whack, so to speak, in concussion. So we'll measure their heart rate when they're participating in that dynamic physical exertion trial, in addition to getting the patient's symptom report and having other objective kind of behavioral observations to really verify from every angle that that athlete is completely asymptomatic, not just at rest, but also with physical exertion. And that's a big box that needs to be checked to meet international consensus criteria for readiness for return to sport. And we have the ability in this multidisciplinary program to oversee that full process without having to hand the ball off to, the athletic trainer or a coach or an unknown party to finish up that piece of it.
Well, it sounds like you guys have checked all the boxes. Lisa, I know we talked about misinformation a little bit earlier rather than the word myths. What is, regarding the misinformation and things like that, what is a message that you'd like to send to other medical providers who they know how to assess a patient and look for red flags and decide whether or not they should go to the ER? But what's the message that you'd like to send to them regarding their concussion care and what to do?
Yeah, I would say because of how rapidly the landscape of research in this area is developing, this really has become a specialty injury. A lot of the things that we thought were best practice even 10 years ago are not best practice anymore. Like I said, they're outdated. And I think a lot of primary cares and generalists don't necessarily know how a specialist could help with this injury, or maybe under the impression that there's no treatment for concussion. And that's not correct anymore. But again, this research has only developed in the last 10 years. So my biggest message to other healthcare providers is that they don't need to take a wait and see approach with these patients and then only refer for specialty care after the person has taken longer than 3 months to recover, because that doesn't feel good for the providers, and it leaves them in a space of feeling unsure or not quite knowing when is the right time to refer. And it leaves the patients suffering needlessly for 3 months. So my biggest message that I would send is that research has shown us that immediate referral for specialty care and having that person seen by a specialist within the first 7 days post-injury can accelerate recovery, not just for our athletes, but also for our everyday civilian injuries. And I don't have a 4-month wait list. I save spots on my schedule for these individuals to be able to get in and start doing the right treatments from jump.
Yeah, as you said earlier, you can increase their recovery by 10 times the speed if we get them in early and engage with them. So that's awesome. Have you encountered any athletes that have come to you that you wish you could have gotten a message out to them sooner? And if so, what would you like to tell them?
Absolutely. The most important message that we need to get out there, and we really need a culture shift in athletics at this point, is that concussion is an injury that needs to be taken seriously immediately, and it is an injury that can be identified immediately. I think a lot of people are under the impression that only after someone has had, a headache that has lasted a few days is it time to consider concussion, but we can identify concussion with acute onset of those symptoms immediately. The signs and symptoms of concussion often occur immediately or at the very least within the first 24 hours. And the number one thing that we can do to promote brain health in these athletes is to remove them from contact sport immediately upon identification of any of those acute signs or symptoms. Not only will that reduce the risk of them experiencing a second impact and potentially setting them up for adverse neurological consequences like permanent impairments or, at its worst, even death. But also, we've identified that when we can get someone starting the right treatment program, they recover faster. So if you wait 5 days to even think about calling a specialist, and then it takes you 2 more days to get in with that specialist because of schedules or whatever, then you're already past that 7 day window that we know facilitates speedier recovery, which is also so important for our athletes because removing an athlete from their team or feeling ostracized from their community, removing their sport, which is probably a huge outlet for stress, can lead to secondary consequences like depression and anxiety, especially, I think a lot about our adolescent athletes and what that looks like for them.
So what I'm hearing you say is when it comes to concussion, don't wait, call Aptiva Health today.
Yeah, exactly. Put that on the infomercial.
That's right. Oh, that's great. Um, we've talked a lot about expediting the care, getting patients in quickly. Can you give us a scenario in which somebody was dealing with concussion symptoms for a prolonged period of time and came to see you guys? And what does their outcome look like, in that scenario?
Absolutely. So our program, our cutoff is 5 years. If you've had a concussion in the last 5 years from which you're still feeling like you're dealing with effects, we'll see you and see what we can do to help. I think one of the biggest things that goes missed by more generalist providers or providers who don't specialize in concussion are some of these vestibular and oculomotor deficits, which aren't necessarily part of routine examinations and can cause symptoms that are a little bit more subtle, and the patient may feel like, I think I'm mostly back to normal. Something still feels a little bit off, but I can't quite put it into words, and I'm going to try and brush it off and hope it gets better. I have probably seen upwards of a dozen patients just in the time I've been here with Aptiva Health who had a concussion up to several years ago, and they continue to experience some intermittent blurred vision, and cognitively, they just don't quite feel fully back to their normal selves, even not overt memory problems. They don't feel like they have amnesia, but they just feel a little foggy or not quite as sharp as they normally would. And we get them in and they have a very clear receded near point of convergence or convergence insufficiency, which is an outcome that can happen from concussion. And when not treated quickly and appropriately, can become, that's what I mean by baked in, that your brain kind of learns to just continue functioning that way, but it is still causing that person deficits that they have to some degree accommodated, but not fully. And we've been able with each of those patients to get them into oculomotor rehab and get them to a full recovery. So there's no, there's no kind of deficit that's too small to be worth checking out. And although I would love to see everyone within the first week after their injury, I know that's not always feasible, but we can definitely still help these individuals.
You guys are definitely giving hope to those who are suffering with symptoms that have been going on for months at a time. That's awesome. And it's such a blessing to have you here at Aptiva Health. And I know there are a ton of people that would benefit from engaging with you and hearing what you have to say. And there's a lot of parents and coaches that want to learn more. Are you accessible to the public? What would that look like if somebody wanted to get more information from you?
Yeah, absolutely. Like I said, I was an athlete growing up, and concussion in sports and athletics is really my passion. And I'm so acutely aware of the culture shift and, getting accurate information out to these key stakeholders in youth athletics that's needed. So parents, coaches, if you are involved in a youth athletics program and you want more information about concussion, or you're interested in talking about how we can get a baseline testing program set up for your team, I am always happy to talk about these things. I go to youth football camps and put on presentations for the parents to learn more about concussion care while the kids are, after they drop them off for camp for 15 minutes. I am happy to share the updated information with anyone who cares to listen. So definitely call us at Aptiva Health and let us know that you're interested in, setting up a session or baseline testing or learning more.
That's great. We appreciate your availability to the public. And if you guys want to reach out to Lisa, you can reach out via referrals at aptivahealth.com, or you can reach out via info@aptivahealth.com, and they can get that information over to Lisa so that you guys can connect and find a time to get set up. Lisa, thank you so much for your time today. I learned a ton. It's always great hearing from you. You have so much good information. Do you have anything else you'd like to say in closing today?
No, I don't. Thanks so much for having me. Like I said, this is my passion, and I love talking to people about concussion. So I'll talk to anyone who wants to hear it.
That's awesome. It definitely comes through in your voice. Your passion does for sure. So thank you so much again for your time. Anybody, if you guys want to give us a call, 502-909-0772. We are your concussion experts. Get in with Dr. Manderino and let her point guard or quarterback your care.